everyone, welcome to today's edition of Exceptional Care with Regions. I am Oswago Precious. With me here today is Dr. Ezebo Malaki.
Miss Oswago, our esteemed viewers, good day and welcome to the show.
So can you briefly tell us what Alzheimer's disease?
Generally speaking, Alzheimer's disease is a progressive neurological disorder that destroys the memory and other important mental functions of the body. Basically, it causes the brain to shrink and makes cells to die. It is the most common cause of dementia. There are late onset and early onset times of Alzheimer's disease. The early onset Alzheimer's disease is usually between the age of 30 to mid-60s, and the late onset is from mid-60s and above. Globally, we have an estimated number of 50 million persons with Alzheimer's disease. In the United States alone, we have approximately 5.5 million people living with the condition. In Nigeria, we have more than 1.5 million reported cases every year.
A lot of people out there would be wondering why this disease was named Alzheimer's disease. So can you please help us clear the air on that?
Thank you. The name Alzheimer's disease was named after Alois Alzheimer, who discovered the pathological features of dementia when he was a student of Dr. Emil Kraepelin.
So what are the possible causes of Alzheimer's disease?
The exact cause of Alzheimer's disease is still poorly understood, but there are several works that have been carried out to find out the exact cause or causes of the condition. Most authorities agree that it is caused as a result of abnormal functionings of proteins in the brain. These abnormal proteins disrupt the work of the brain cells and trigger a series of toxic events. During these events, the cells die and the connections are lost. There are also genetic and lifestyle and environmental factors that are also believed to cause Alzheimer's disease.
What would an individual or a doctor see in a person before the doctor highly suspects that the individual has Alzheimer's disease?
Primarily, you have memory loss, impaired decision making, language problems, reduced ability to think, remember, make decisions, or function independently. Mild symptoms are memory loss, poor judgment leading to bad decisions, loss of spontaneity, taking longer to do normal tasks that initially were easy to do. For moderate signs, you have increased memory loss, inability to learn new things, difficulty with also organizing thoughts, thinking logically, shortening the attention span, problems coping with new situations, difficulty with carrying out multi-step tasks. For severe signs, there could be inability to communicate, weight loss, they could have seizures, skin infections, difficulty swallowing, grunting, increased sleep, and loss of bowel and bladder control.
So, Dr. Ezebo, it is commonly believed that Alzheimer's disease is normal with aging process. What's your take on that?
That belief is not completely true, because there are some risk factors that will predispose an individual to Alzheimer's disease, and they include age, a positive family history or genetics. You have a patient that have had Down syndrome, individuals that have mild cognitive impairment, individuals that have head trauma, especially with traumatic brain injuries, excessive alcohol consumption, especially in belch drinkers, poor sleep patterns. Then you have individuals with low exercise, obese patients, smokers, patients with high blood pressure, high cholesterol levels, and patients with poorly controlled diabetes mellitus, type 2, basically.
If someone is diagnosed with Alzheimer's disease, is there a cure for that?
Unfortunately, there's presently no cure for Alzheimer's disease, but there are medications that are available that will temporarily slow down the progression of symptoms. There are also support services that are available, to support the patient, the relatives or someone that takes care of the patients, and help them. That will also help them to cope with daily life.
Finally, doctor, are there preventive measures an individual can take in order to avoid having Alzheimer's disease?
Unfortunately, Alzheimer's disease doesn't fall under the list of diseases that are preventable, but there are lifestyle modifications that can help reduce the risk of an individual coming down with Alzheimer's disease. Evidence also suggests that diet, exercise, adequate exercise, and behavioral modification could also help to reduce the risk factor of coming down with Alzheimer's disease and dementia. Studies have also shown that if an individual engages in mental and social activities, like as simple as dancing, playing, getting involved with board games, and creative arts, playing an instrument, this will reduce the chance of somebody or an individual coming down with Alzheimer's disease.
Thank you, Dr. Zabogo, for making yourself available today. It was really concise, educative, and informative. And I'm very sure our viewers out there learned a thing or more about Alzheimer's disease. Thank you.
Thank you for having me today. Thank you very much.